The American Hospital Association estimates there are more than 6,000 hospitals in this country. Of those, only 259 received honors as top performers for heart attack patients. And 2 of those hospitals are right here in the Quad Cities at UnityPoint Health, Trinity, Rock Island, and Bettendorf. Now, the award goes to hospitals with a high standard of care for heart attack patients, as well as facilities with, quote, aggressive goals of treating those patients. It's why cardiologist Dr. Param Singh is joining us here now on The Current. Thank you so much for being here with us.
Sure, it's my pleasure. Good evening.
Well, why don't we start with the extent of the issue here? I mean, heart disease causes nearly a quarter, 25% of adult deaths in the Quad Cities. How often do you receive heart attack patients at UnityPoint Health Trinity?
So, as you said rightly, the cardiovascular disease continues to be a major burden not only in our community, but it is a nationwide phenomenon. We typically have 1 to 2 major heart attacks coming through our ERs in both campuses in a week. Those are major life-threatening events, but we do have a lot of cardiac patients who come to the hospitals, the ERs, the urgent cares, who need urgent attention so that they can get the appropriate care.
And, for people who have never been impacted by a heart attack, if you survive it, how does your life change after the fact? I mean, what are some of the long-term impacts?
To be honest, in this day and age, it doesn't change much. Heart attacks are typically caused by a blockage in one of the heart arteries. And over the last few decades, the advances in medical science has allowed us to address those issues very promptly and to alleviate the symptoms to almost nothing. So at this point of time, the heart attack patients, they get immediate treatment. Most of them are discharged in a couple of days. They undergo some investigations and a cardiac rehab process, and eventually they are able to lead a normal life as if nothing ever happened.
So what makes UnityPoint's care so exceptional? What all do you guys offer?
So UnityPoint is one of the 2 major hospitals in town, and the cath labs are equipped with the state-of-the-art equipment. We offer all services throughout the spectrum of cardiac diseases, from the treatment of acute heart attacks, valvular diseases, to congestive heart failure, and even arrhythmia treatments. Obviously, receiving this award is a testament to the fact that the care at UnityPoint provided by the nurses, the doctors, our techs is superior and up to par with the highest standards hospitals are held to.
All right, so while the care is award-winning, how do people prevent needing it in the first place? What are some tips to keep your heart healthy?
So heart disease thrives on certain key ingredients: controlling your blood pressure, keeping it in normal range, avoiding bad diet, keeping the cholesterol, the blood sugars in range, and generally following a healthy lifestyle. The American Heart Association has very clear guidelines. Exercise at least 30 minutes, 5 days a week. Eat a balanced diet, watch the amount of sodium and fat you eat. And to be honest, that's all it takes to prevent heart disease as much as we can do. Eventually, there are certain risk factors which we call as non-modifiable, which do play a role in heart disease, and they tend to catch up. But at least all of us can do what we can do to prevent heart disease.
I love it. And you know what? If something happens, UnityPoint Trinity is there to help you out. Dr. Singh, thank you so much for joining us today.
Thank you. It's my pleasure. Thank you.
And hey, we also have this information up on our website as an online article. You can find it at WQAD.com underneath the As Seen on TV tab.